Good afternoon, everybody. Thank you very much again for taking time to join this webinar. This is our kind of weekly chance to just check in with one another and for me to give you just a few updates and hopefully for you to raise any questions you want to at all. If you've done this before, you'll know that there is a chat function that's on your screen that allows you to submit your questions. We'll pick up as many as we can. If I don't know the answer, I'm going to be honest about that, but we'll get the answers and we'll make sure that when the recording of this goes out, we've also got the updated list of questions and the proper answers if I've had to find them. So you'll get the full answer to anything you raise. We're going to focus today on staff wellbeing, and we've got Bev Flint with us, I'm delighted to say, who's been doing this amazing work supporting staff wellbeing right across not just this organisation, but our partner organisations as well. So I'm going to kick off in a minute with some questions, some conversation about that. Please do ask us your questions or raise any issues that you want to about staff wellbeing, but don't let that stifle anything else that's on your mind. So if there is something else that you want to raise, this is your time, and it's not for me to dictate what the topics are. I'm going to just give a really quick kind of general update on a couple of things before we then kick off focusing on the wellbeing issues. So first of all, as always, I want to start by thanking everybody. I am continually amazed by how fantastic you all are in terms of just sticking with what I know is a very arduous time, and continually amazed by the sacrifices that you all make to keep working in sometimes very tiresome conditions with much more difficult journeys to work. Some of you, and I want to give a particular shout out about this, some of you of course are staying away from home, staying in hotels because you're shielding family or friends that you share your lives with. So particular shout out to those people. It's not much fun in these days when we haven't got nice cafes and things to go to outside of work to be stuck in a hotel. So thank you very much. But thank you to everybody. Just 2 or 3 things that I want to kind of draw attention to. First of all, I'm sure you, like me, have seen all the amazing thank yous that are going on across the country. I hope you are brimming with pride when you see the clapping that goes on every week. And I hope that all the other things, the kind of broadcasts there have been, all the other things that are going on, I hope they touch you and you kind of feel them. You will particularly have noticed all the publicity around Tom Moore's charity and the amazing walk that he did around his garden. I'm sure we were all, again, very emotional watching that happen. Some people have asked what we're going to do with our share of that money. We have had a small-ish share of that money already allocated. It's thousands, not millions, just to get your expectations in line. We do think that there might be some more that comes in, not just from the money he raised, but other wider fundraising that's going on across the country. So people have been saying, well, how's that going to be spent? Clearly, there are some kind of rules about what we can spend it on, rules that I hope you would agree with that work in your favour. So we can't just kind of use it to fund our staffing, for example. What I'm suggesting that we do is that we ask people who've been working on staff wellbeing particularly and have been in touch with a lot of you, what the themes are and what some of the options for spending that money might be. And we'll put together a short list and then we'll send those out and we'll ask you to vote and say what you think would be the best thing. If when you see that short list you think this is something blindingly obvious, that actually would be a fantastic thing, we've all been asking for ages, Angela, how could you not have thought of it? Then of course speak up. But really, rather than try to manage 1,500 suggestions of things we could spend it on, we thought it might be helpful if we at least kind of narrowed it down into themes and ideas. So that's what we will do. But if you have particular thoughts about how that could work going forward, do come back to us. The second thing is I want to say another word about PPE. Particularly because there's been so much in the media about this and because it's something that comes up a lot when we talk to people who are working either in the front line or not perhaps in clinical services, but nevertheless interacting with service users' families or with the public in general. So I just wanted to say again that at the moment we are not experiencing any shortages in this organisation in terms of supply of PPE. So please don't worry about that. You have heard about issues with gowns. We don't use a lot of gowns in this organisation because we're not running ITU services, which is where the majority of those are needed. So no shortages at present, and I'll be honest with you if that changes. PPE guidelines apply to everybody that's working in areas where they are coming across service users, carers, or the public face to face. So if you're not a clinician, you might come into one of those groups. So I would just encourage you again, if you're anxious about this, if you haven't got the right protection, or you're not sure what the guidance is, please speak to your manager, please get that support, and make sure that you are following the right guidance and you've got the right level of protection. I don't want anybody worrying that they haven't got the right level of protection. So we had a couple of queries this week from people in sort of administrative functions, but dealing with the public, and I was really clear that of course some protection will be required and you need to make sure you've got it. I'm not going to go through the details because I've only known me and only make a mistake and then that would be terrible. So just make sure you've got the guidance. And we are hoping we're going to get a nice diagram or picture coming out soon nationally, and you can send that out. The second thing that I want to say is that you will have heard again in the public media domain that there does appear to be some disproportionate impact of COVID-19 on some groups in our population. So BME members of the population don't appear to be any more likely to get COVID, but it does seem to be disproportionately having a more severe impact on that group. This is still something that is being investigated at the national level. We don't have absolute clarity, but it does look as if there might be something going on there. So I am asking people, and something will go out in the communication today, if you are in that group, would you please have a conversation with your manager about your own particular situation? That means, you know, the position that you work in at work, how much exposure that you might have, what your risks might be, any of your own health issues that might come into play. Just have a confidential conversation about that. And if we think that, or you think that, some additional level of protection, for example, might be important for you, then of course we can make sure that's put in place. So we'd like people to do that. And there are a couple of other groups that you know that in terms of gender terms, men seem to be more impacted, and of course there are the age group issues have already been kind of very widely raised. So it'll go out this afternoon in the briefing. Please, please, please do take account of that, and particularly perhaps for that BME group where it hasn't had particular attention in terms of action to take till now. We are asking in this organisation that you just consider whether there's some further protection that we need to give you. And I think that's probably it for me, so I'm going to take up all the time. So I'm now going to kick off the conversation with Bev around wellbeing and wait for your other questions to come through. So Bev, I know you've done loads of work on this, and thank you so much for that. Would you like to just say something about how important you think it is for staff at this time to be looking after their own wellbeing?
Sure, I would say that it's important at any time. It's certainly my priority. I think at this time, everybody's working under very different circumstances, very stressful. There's a lot of personal anxiety out there, lots of change to routines. So more people are working from home than they might have done before, or having to come into work when national guidance is trying to get the majority of us to work from home. So it's quite challenging to know what to do for the best. And so, transparency is key. So rather than worry, talk to managers and get further advice. In terms of looking after our own well-being, I've spoken to a number of people in the trust now and beyond. And it's the biggest impact, other than the obvious worry, is the change to routine. So people are reporting not sleeping very well. Often the brain is just switching on, they're trying to solve problems into the night. Because we do have brilliant people working here, and they're trying to do their best, and the brain won't allow them to rest. I've also heard reports of people not eating as well as they should. I have to say my chocolate consumption has gone up quite dramatically. It's half price Easter eggs. And also the lack of exercise. Again, you know, we're given quite strict guidance about kind of getting out just once a day. Lots of all the gyms are shut, which a lot of people were relying on.
Yeah.
I did the Joe Wicks workout the other day. I couldn't walk the following day, so it really works. So it is about, like I said, well-being is important all the time. I mean, I'm not going away, and so well-being will definitely be on the agenda. But we need to look after ourselves. We need to look after each other. And we need you. We need you to be well, and your families need you to be well.
Yeah.
But more importantly, we need to be well. So.
Yeah, and this isn't a quick situation, is it? It's something that we know is likely to go on for some time. So actually, we need to look after our resilience to be able to keep working. And falling over is not going to help. Not going to help us, but it's not going to help anybody in the long run. So, what would you say for managers to sort of, you know, hopefully are really thinking about the well-being of their team? What are the sort of things that you think that managers could do to offer support?
Again, a connection at this time is absolutely crucial. I'd say it's crucial any time, sort of open communication. But especially, particularly if you've been redeployed, which is hugely anxiety provoking, or you're not seeing your teams as you might regularly. Having Zoom chats and virtual meetings, I would say, is absolutely crucial that you are keeping in contact with one another. Managers also have managers and pressures, and that's I think managers, we can role model decent behaviour, good behaviour, and compassion and kindness is not a luxury. I think it's a necessity. And I think, so actually one thing that I am doing with some colleagues in the trust and senior colleagues is contacting managers just to see if there are any areas that they need some help with, but also if they're worried about anybody. Confidentiality is absolutely key. So if somebody does contact me, which I've had a number of people contact me who are having understandable struggles, I don't report that back to their manager. It's nobody's business but theirs or mine. I've not had any reason to be concerned to escalate anything. I don't anticipate that from the.
Well, that feeds really nicely, actually, into one of the questions that we've had. So we've had a question from somebody saying from their manager. Actually, I've been thinking about that a bit recently when I see all this kind of NHS heroes thing, and that there is a downside to being placed in the position of being a hero, because it's quite difficult for heroes to say, actually, I'm a human being beneath this hero status, and that means that I might have my own fragility or my own off days or my own moments when I need a little bit of extra support. So if somebody's worried, but they really do feel that they need a bit of support, but they don't want to raise it with their manager, what would you suggest? What would be your advice?
Please don't suffer in silence. I would say that like I said, I'm not going to be reporting back to anybody. It's nobody's business. So please drop me a line at the wellbeing at candy.co.uk address, and I or a colleague of mine will be in touch. There is a national helpline as well, which has nothing to do with the trust, and I can we have published the details, but we will publish them again. And so that's also an option. But what I would say is I would encourage people to be open. I think NHS staff are the most resilient people on the planet, but we are also fallible. And we need to stop and have a break. There are many people who don't feel it's okay to have a weekend at the moment. And I think, well, we've got to rest. We're in the business of mental health care. We need to show that to ourselves and to our colleagues and our managers as much as possible. If we
don't care for us, we can't care for others. So that plays into a nicely leads it's great. So from home, I'm finding it really hard to switch off at the end of the day because there isn't any more that divide between work and relaxation. I completely recognise this personally, if I could just say this. It's really difficult, and it becomes so easy because you set yourself up for working from home to actually not be disciplined and kind of keep dipping back into the emails or whatever it is at hours of the day you normally think of doing that. Don't know about you, but I also find it quite hard because all of the television and radio is about COVID, so sort of keeps your mind working in terms of your working responsibilities around that. You know, I know I've had to really think about that. So interesting if you've got any tips that you've come across to help people kind of switch off, you know, for the line in the sand, work's finished now I need to we don't have those journeys home where we can sort of start to get into the novel or think about what we're going to do in the evening, and it's more difficult, isn't it?
It is much more difficult, especially because of the business we're in. We have learned from other businesses that have been remote working is normal. And so the guidance that we all know, but it's hard to live by, is to have a routine and stick with it. So get up at the same time, get showered and get dressed. Don't do your first meeting in pajamas, even though it might be tempting. So stick to that routine. Have breaks, which I have to admit, for the first 2 weeks I didn't have a break. I didn't have a weekend, and you know I struggled and suffered because of that. And so now I've got good. I have set times when I will call my friends and have a virtual cocktail hour with all of my colleagues here on a Friday at 5 o'clock, you know, because once I've opened that bottle of wine, I'm not working because I'm not allowed to. I'm not saying we should all turn to wine as the permission to stop working. My point is to have a routine and stick to it. Yeah. For your own sanity and your own well-being. Turn your work mobile off. Tell people that I say that to people, this is my work number, but I will turn it off at 5:30. People are very respectful of that. Yeah. I turn my emails off. I'm sometimes quite tempted to go back in, but I don't because I have to switch off. I've actually started with word puzzles, and I'm hearing other things from colleagues. So the Headspace app is quite nice. Do some like 10 minutes of mindfulness, and that can mark the end of your working day. It's a beautiful day. Get out for your walk at the end of that day, so that you are having a walk home as well. Routine is key, and sticking to it for your own sake.
Yeah, great. All really good ideas. And I did a mindfulness moment. I can't think what I would quite call it. For the first time ever in the last couple of days, it lasted 6 minutes. It was a 6-minute, talking through. Really helpful. I've never done it before, but I know that I will do it again. And I've also taken up new occupations, things that can just take me away from work for a few minutes. Early, maybe doing a puzzle or a bit of sewing or something that kind of takes my mind away from things. Now, this is a tricky one. It's a question that's come up here. I'm sure many people might have some empathy with this. So somebody's saying, my manager's emailing me at home with lots of work, and it doesn't always feel very kind. So what can I do if I'm feeling, rather over-demanded, and that importance of not being overloaded, having those breaks, all those things you've just talked about, if that doesn't seem to be recognised by the person that I report to, quite how do I manage that? So it's a tricky one. I mean, I might have my own thoughts, but is there anything you want to say first?
Well, I guess I'm in a fortunate position that I would feel that I could say that to my manager, but I get the feeling from that question that might not be the case for this person. Yeah. It's difficult to say without knowing context. But I do empathise, and I think I imagine you're doing your best, and actually the work that you're doing is measurable. I think it's they'll be able to see that you're doing what you can. Yeah. I think being able to say I've got too much to do is a really hard thing to do, but I think it's necessary. Before this happened, I think it was necessary. Yeah, but I'm interested in what you say.
I suppose the advice I would give to somebody is mirrors exactly what you said. The first thing I'd say is being able to say that, just rehearse in your mind, could I just have a word with you, actually not about the content of the job, but just about how we're working, now that we're in this new arrangement, would it be all right if we just reviewed how that's working from both sides? So you, my manager had to just give me some feedback, and could I just say that from my perception, this is what's going really well. It's always good to start with positive, isn't it? But I do find this, sometimes I feel as if I'm being asked too much, or I'm being asked beyond the hours that I would normally work, or I need a break. So putting it in a context where you're both reviewing and there's a kind of mutual, let's just check in with one another on how this is working. That might work. It's certainly worth, if you feel able to, I would really encourage you to try it, because managers are under stress and under pressure as well. And I would guess that for the vast majority of managers, if they are over demanding somebody, they don't mean to, and they don't realise they're doing it. It's because they're being pressured and they're just not sense checking. And actually, it's pointed out in a kind of a constructive way. They'll adjust the way that their people obviously want to do the right thing. So try that if you can. But if you really don't feel that you can, if you feel actually the style of the relationship that we have, I'm not comfortable about that and finding it a bit too difficult, I would really encourage you to speak up. And this is a good chance for me to just remind people that the Speak Up Guardian service is still operating. In fact, we had our first report from them just a few days ago, and it was really positive reading in that where they had issues raised to them. And can I say that people obviously have a lot of confidence in the service because they are reporting, but what they had often been able to do was get in some mediation, to kind of sit down, have a little chat with the manager on the other side without naming names. I think there might be a few issues in your team about, have you thought about this, with some really positive outcomes. So it might feel like that's the end of the line if you go that far, but you can confidentially raise something in the Speak Up Guardian. You can say, I don't want my name passed on, I don't want this, but you could explore in more detail what your options might be. And of course, there are plenty of other people around to help, so just having a conversation about it would help. One of our wellbeing team, that's of course absolutely there on offer. If talking to somebody in HR would help, that's absolutely on offer. If you feel you need to go a little bit higher to sort of get a sense check of what you might do, go to your manager's manager, please feel able to do that. The most important thing is don't do nothing, because the worst thing would be if you just stuck with it and it had a bad effect on your health, or, this is my other worry, you just start to think, actually, I don't think I want to be in this role anymore, I'll do something different. And then I'll have lost a fantastic person when actually we probably would have ironed it all out. So please, please, please come forward. I've got a feeling that there's another question here that I've missed. Oh, this is a really good question. Gives you a bit of a break there, because it's not about well-being. So we've been firing things in your direction. This is a good one, and unless we get any more, I might end on this one. So somebody said, do we have an exit plan for returning to normal? And is it going to be phased, and what services are going to return first? So a bit of a long answer to this one. I'll try and be succinct. First of all, we are beginning to think about that plan, and we're beginning to think about that plan not just as a trust, but as a system locally. So there's a lot of thinking that's going on across the system, all joined up, about how we start to restore and recover from the peak demand and the changes that we needed to make. That's been mirrored across the whole of London. So there's every layer, this planning is starting. And the mental health trust CEOs have also started somewhere nationally. So just on every single level, this bit of thinking is going on. It isn't going to be as simple as it might sound, because it isn't a matter of we now want to just go through a series of stages where we open up things that we had changed and go back to how we were doing them. Partly because some of the changes we've made, we want to keep. So I am sure that there are some people who are now working in a more virtual way that think, actually, there's some elements of this I think work really well and they would like to continue doing. It's the better way for them to work. That won't apply to everybody, but where it does apply, we want to keep it going. So a lot of the kind of IT technology improvements, let's keep using those. There are some new services that we've set up that I'm hearing really positive feedback. Again, we don't want to just go, oh, well, we don't need that anymore, now we're going back to the way we were. Let's hold on to the good. So we are working through what do we need, what changes have we made that we want to take forward into whatever the new normal is. What are the things that we have either reduced in the way that they operate or temporarily had to suspend. So some of the group therapies, for example, how do we think about how we continue to offer that going forward, but probably maintaining social distancing for perhaps some time. Sure, you can pick up from the national conversations. We may be doing that for months, not just for weeks. And so I can't answer the question about which services will start to open up first, but I can tell you that the thinking is going on. And I would hope very much that in the next 2 to 3 weeks, we would have a more coherent kind of sense of what that looks like. And we are going to be coming out and asking people's views, so that the things that you have been doing differently, you can say if you think you want to maintain those or take those elements of those forward. And also other ideas. So look, I've got a great idea about how I can provide a group therapy service that I used to do, but I can see it's not going to go back to that's not going to work, but I can see a different way that I could offer that support to my patients, for example. So we really want to get everybody's input to this. We'll do it under the framework of looking at the clinical strategy, which you know we've signed off. So yes, that work started, and we'll be coming out and asking you all to help shape that plan very, very soon indeed. Unless there are any final burning questions, I'm just looking at my wonderful comms support. If not, we've been going for almost half an hour, which is about our timeline, so I'll probably stop there. If there are any questions that have come through that we haven't got to, we will write them up and they will go onto the website alongside the recording of this webinar with answers. So if you've asked a question, I promise we will answer it. I just want to finish by thanking Bev for all the work that she's done and continues to do. Please check in on the website so you know what support there is that's available. Please do email. Please just say the email once more if there's a query from somebody.
You can either email me directly or please email wellbeing@candy.co.uk.
Fantastic. So please do that. Please check the resources. We've got some wonderful wellbeing spaces that we've opened up now that we were just talking about before this meeting started. And most of all, you know, your health and wellbeing matters more than anything. We're in this probably for a bit of a longer term, and we will need to support one another. And I'm determined that we keep thinking about how we can do that better. So thank you for your time, and I look forward to speaking to you again next week.